My name's Russell Dawe. I'm a family doctor in St. John's, Newfoundland, and faculty at Memorial University of Newfoundland here in Canada. I'm going to tell you a little bit about some of the research that I've been partnered in over the past few years. One question that I wanted to chat about is what inspired the research question or idea. And this is a bit of a story, I guess. It was in 2016 when I was working to establish a Care of Underserved Populations fellowship program for our family medicine graduates. And I went looking for community partners to engage in patient-oriented or community-oriented research. And I was talking to a colleague who had been working for decades with an Innu population up in Sheshatshiu, Labrador. And he connected me with Jack Panashway, now my co-primary investigator on our current project. And Jack has, of course, given his permission for us to do this presentation today. We started out with not so much a question as a desire for a partnership so that we could build some meaningful research with the community into this program. And so this colleague invited me up to spend a week on the land with an Innu gathering, and I just got to meet people, started some relationships, and it wasn't really until the follow-up phone conversations following that week that we got into what might be a good question for us to research. And it turned out that the community, and particularly these couple of leaders who I had just connected with, had some lived experience, had some personal sense that there was a need for research around the issue of culturally safe end-of-life care. And so I came up for another trip, had some more conversations with other community members, had numerous chats and emails with Mr. Panashway, and yeah, that's how this emerged. And I think the key point here being that we went looking for a partnership, and those partners had this lived experience of a felt need. What our project is about then has been the cultural, traditional, spiritual end-of-life care needs for the Innu in Sheshatshiu. And we also wanted to do something mixed methods to look at some population data and contextualize the qualitative findings on a demographic basis. Of course, COVID-19 has presented us with its share of barriers along the way, not the least of which have been some time delays. And flowing partly out of that has led to changes in the availability of certain research personnel, especially community-based researchers, because we're trying to do this as grassroots as possible to keep it culturally safe and relevant to the community's needs. Some of the public health restrictions, which were necessary, of course, nevertheless impacted our choice of methods. Doing multiple interviews became more challenging, and so we had to switch to a focus group model. But that worked very well in the end, and actually there were some real positives that came out of that. Another challenge that came out of COVID-19 was regarding our plan for knowledge translation. We originally had a plan of holding a big event on the land during one of the annual Innu gatherings, getting tents, pulling lots of people together, things that obviously weren't going to work now that we had social distancing parameters to consider. So we wound up switching to a much more limited attendance town hall with lots of social distancing. That still provided us with a safe way to meet with the community and chat about what our findings were looking like. And that's very important. You know, a lot of things have been switching to virtual, and we did talk to our community advisory board, our Innu advisory board, about whether we should be trying to do these things virtually. And they said, no, it's not going to be accessible to our community if you make it virtual. It really needs to be in person here on our land. And so we had to take care to do that in a safe way. And it did involve a little extra work, but in the end, it was really productive. It did also leave me wondering, though, how we could reach more people, since the town hall had a limited capacity, and I noticed, just being in the community, that there were some really beautiful paintings up, and that they really captured a lot of the expression of the people. And so we were able to reach out and commission a local artist to paint a visual representation of our findings, which, when you have a population that a large portion of them were not English speaking or reading, then we needed something outside of written reports, however short or lay language they may be, in order to reach the population. As for the impact that we hope our study will have on the community, we're hoping that it'll provide opportunity for an increased provision of culturally safe care around end of life and palliative care needs. And also, that these partnerships and some of the work that we've gone through will facilitate future patient-oriented research, community-based research with Indigenous populations in Labrador. We had a chance over the course of this to work with a contracts officer to develop an Indigenous research agreement, something that was much more collaborative and reciprocal than the standard collaborative research agreements, which didn't really translate well for us into a Indigenous health context where we have the OCAP principles to bear in mind, and those are very foundational to this research. Lessons learned from this experience, I would say always be prepared that community-based research will take longer than you think. And I was fortunate to have a very understanding and collaborative grant agency working with us. And also the importance of partnership and open communication when things are not going perhaps the way that you might have expected them to. And you need to have those open lines of communication back and forth between you and your community partners, making sure that you are working with them, hearing their concerns, and working together to come up with good solutions. Every step of the way, listen to your community partners, empower them to make decisions, and find ways to incorporate them at every stage of the process, and your work will be so much richer for it.